Hello class, my name is Yvette Beltran. This is my video presentation number 2 for KINE's 3200. For today's muscle, I am going to be talking about the rectus femoris. The muscle of the rectus femoris does involve both the pelvic girdle and the hip joint, in which body movements typically involve both of those. So for example, in walking, there is hip flexion and extension occurring when the pelvic girdle is rotating. So if we're looking at the anterior aspect of the muscles in the hip joint and the pelvic girdle, that rectus femoris is going to be lying in the anterior aspect of it, which primarily involves in movements such as hip flexion. Along with that, the rectus femoris is a muscle within the pelvic girdle and the hip joint. However, it is also a muscle within the thigh. And it is also on the anterior aspect of the thigh, acting primarily as the knee extensor. Now let's talk about where does this rectus femoris originate and insert. So the rectus femoris does originate in the ilium, and it does insert all the way down to the patella. The main movements of the rectus femoris involve flexion of the hip, extension of the knee, and the anterior pelvic rotation. Now that we know where the rectus femoris originates, inserts, and the movements that it provides, I'm going to go ahead and demonstrate each of those 3 movements. The first one is going to be the anterior pelvic rotation. So the anterior pelvic rotation is the anterior movement of the upper pelvis, the iliac crest tilting forward and going into an anterior tilt into a downward rotation. So basically this is going to be, so we're in neutral position. So we're going to go ahead and I'll go ahead and put this up so you guys can see. So anterior tilt, neutral position, we're going to go ahead and do that anterior movement of the upper pelvis in which the iliac crest moves forward, going into an anterior tilt into a downward rotation. Going back to neutral, going back to the anterior pelvic rotation. Possible movement that the rectus femoris provides is hip flexion. So hip flexion is the movement of the femur, which is this long bone. The movement of the femur is straight anterior toward the pelvis. So for example, we're going to go ahead and bring that femur anteriorly toward the pelvis, and it does provide a movement from 0 to 130 degrees. Another movement that the rectus femoris does also provide is the extension of the knee. So the extension of the knee comes about when your knee is flexed, coming back down to neutral position is going to be the extension of the knee. So we can go ahead and do that again. So right now, our knee is flexed, and to go ahead and go back to that neutral position, we're going to extend the knee, activating our quadriceps or our rectus femoris, in which will give us that ability to extend. And how does this come about in our daily activities? Simple. The rectus femoris is a major muscle within our leg segment. So the primary movers, obviously, for the rectus femoris were the flexion of the hip, extension of the knee, and the anterior pelvic rotation. So for any daily activities, such as going to pick up an item from the ground, we are going into hip flexion, as well as when we're coming back up, we're going into that anterior pelvic rotation and that knee extension at the knee. So that's one of the daily activities in which does involve the rectus femoris. Another daily activity that involves in it is majorly in any sport. So running, walking, athletes that are playing soccer, basically any type of sport does involve the rectus femoris, since it does involve a hip flexion of walking and running. So that is 2 daily activities in which we use our rectus femoris. How can we further strengthen this muscle and stretch? I will go ahead and do a demonstration of a strengthening exercise for hip flexion, knee extension. Strengthen the rectus femoris, we already went ahead and did leg raises, which is one of the 2 ways in which you can strengthen your rectus femoris. Another way we can do it is doing leg extensions, and we're going to go ahead and do that with the band. So you want to place the band right underneath your foot, right underneath the top of the foot, and you want to pull it as hard as you can to the side of the chair. And to extend it, you want to go ahead and extend into a full range of motion. And this is going to help strengthen your rectus femoris. You want to do that a couple of times. 2 ways to strengthen this muscle. There's also ways in which we can stretch this muscle. So stretching the rectus femoris can be done in knee flexion or hip extension. So for knee flexion, we're going to go ahead and grab our foot, bring it towards our buttocks and pull. This is going to create a deep stretch along our rectus femoris. We want to hold that for a few seconds. Hip extension, it is going to be the movement of the femur, being the longest bone, straight posteriorly away from the pelvis, sometimes referred as hyperextension. So to go ahead and stretch the rectus femoris, we're going to perform hip extension, which is moving that femur towards the back posteriorly, and that is going to create a hip extension. So it is going to be that opposite movement from flexion down into hyperextension. So what are some possible injuries that can occur within the rectus femoris? As well as any other muscle in our body, we can get muscle strains. So within the quadriceps muscle strain, it can be due to an injury that is usually due to an acute stretch of the muscle. And it's often at the same time due to a forceful contraction or repetitive functional overloading. So to conclude, that is my video presentation for the rectus femoris. I went ahead and described and explained the origin, the insertion, the muscles, and the muscle action this rectus femoris provides, examples of daily use, ways in we can stretch and strengthen this muscle, as well as possible injuries that can occur within this muscle. Thank you for watching, and I hope this helped you guys out. Have a good day.